Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Piroxicam. Its brand name is Feldene. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Piroxicam. We'll then touch on an example of dosing and then finish it off with side effects. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Piroxicam is a non-steroidal anti-inflammatory drug, or an NSAID. Aside from anti-inflammatory properties, it also has anti-pain and anti-fever properties. It works by decreasing prostaglandin synthesis through inhibition of COX-1 and COX-2. In terms of indications or reasons we prescribe this medication to a patient, well, we would often see this medication prescribed in the treatment of osteoarthritis or rheumatoid arthritis. With respect to contraindications or reasons we would not be able to prescribe Piroxicam to a patient, well, we wouldn't give this medication to a patient who had a hypersensitivity to Piroxicam or to any other component of the formulation. If a patient had asthma, urticaria, or allergic type reaction following aspirin or other NSAID administration in the past, they would also not use Piroxicam. Finally, we would not use this medication in the setting of a CABG or coronary artery bypass graft surgery. Now for an example of dosing with Piroxicam. So in the treatment of both osteoarthritis and rheumatoid arthritis, we would typically see 20 milligrams per day, orally, taken as a single dose, or it can be taken as divided doses. As with all medications, there are some side effects or adverse reactions that patients may experience while using Piroxicam. We'll go over some of those here now. Some patients may experience pruritus or itchiness of the skin, as well as a rash. Others may experience abdominal pain, constipation, diarrhea, or flatulence. Heartburn and indigestion are possibilities, as well as a loss of appetite, nausea, or vomiting. Some patients may experience increased liver function tests, dizziness, or a headache. Some patients may experience tinnitus or abnormal renal or kidney function. The more serious side effects would be hypertension or high blood pressure, bronchospasm, congestive heart failure, or a gastrointestinal hemorrhage. Alright everybody, that's all we're going to talk about today with Piroxicam or Feldene. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. But for today, take care.